Yes, we are live now. I think we can start the webinar.
Yeah, hi, good afternoon to everybody who's joined us today. Welcome on behalf of all of us at Scripbox. This one is slightly different. Typically, we talk about money, we talk about investments, we talk about the right thing to do, but with your money. This time, we felt it was appropriate that we share our learnings, share the learnings from the panel of doctors in this time. All of us know we are all individually impacted. And at the outset, our deepest condolences to many of us who've lost near and dear ones. This is a crisis none of us can individually solve. And we really can't on this help with things like beds, oxygen, etc. That said, the intent is today to provide some simple answers to what is happening all around us, talk about home care, talk about what to watch out for, talk about some of the medications, talk about vaccines and their efficacy, and a multitude of things. It's likely to we expect it to be an interactive session. So please post your questions on the YouTube link, and the doctors will try their best to answer them. We've got two doctors joining us. Unfortunately, Dr. Prashanth Reddy is held up in a surgery in this time of crisis, as you would know, all hands on deck. And Dr. Thukral has been kind enough to join us. Dr. Thukral is probably one of the most experienced doctors and administrators in this COVID crisis, at least. We're extremely grateful to him that he took time out. As you can see, he is actually currently struggling with conjunctivitis, but has been kind enough to join us. Those glasses are to prevent the glare from the screen. He's the founder and CEO or Chief Operating Officer of Healthcare at Home. They've done yeoman service to the country by providing home care to innumerable people in the country. Doctor will share some details with us. He's on a number of panels which help the government. He's a member of FICCI. He has over 20 years of experience, which is relevant to us. So without taking too much time, I'll just hand over to Dr. Gaurav Thukral. Doctor, thank you very much for joining us. And thank you once again to our audience. They're here to learn, they're here to listen. So over to you, Doctor.
Thank you, Adil. Thank you for having me here and for the viewers of Scripbox. I think these have been unprecedented times, and unprecedented times call for unprecedented measures also. So what I'll briefly do is I'll give a small presentation on who we are, what HCAH is all about, one, what we were doing pre-COVID, how the life changed for us in the first wave, and how it altered everything in the second wave, and what impact we were able to do. And then once Dr. Reddy also joins, we can take questions from the audience. So I'll just try to showcase a presentation. Is my screen visible?
Absolutely, Doctor.
So HCAH, or Healthcare at Home, which is a very self-explanatory name, we are promoted by the Burmans, who are the promoters of Dabur, and the founders of HCAH UK, who were the leading pioneers of home healthcare in the world. We are the first largest hospital outside the hospital. I would say largest phygital disease management. I'll come to it later on when I explain what is phygital. We are the first accredited home healthcare organization, where these accreditation standards are benchmarked with the best 4 in the world. And because it's our people who matter the most to us. We don't have buildings, we don't have big machines, infra. What all we have is our people. So we are the first and the only Great Places to Work certified organization in this domain. We have been around for a decade now, have served more than 20 lakh patients over the years. have a footprint in 70 plus cities, deliver specialized direct to patient medication in 600 places. Very, very gung-ho about our net promoter scores for our customer services, upward of 65% for the last 7 years now. Have more than 1,000 people across these 70 cities, work with 40 plus pharma companies and in 20 disease therapy area. But one thing which differentiates us is the outcomes which we deliver, which I'll be talking about. So as I said, we have a legacy of Burmans on one side, 125 years and 25 years of HCAH UK. A very strong management team and where everybody has been there for more than 5 years and most of them have been from day one. What we do is we touch the patient at all points, right from disease awareness to diagnosis, to getting a doctor teleconsultation, to fulfilling the prescription in terms of lab imaging, to hand-holding people on treatments like starting somebody on insulin, on interferon, setting up everything outside the hospital in a hospital, right from ICUs to HDUs to ward equivalent attendants, daycare procedures in terms of dialysis, chemotherapies, consultations right from EICU to specialist to GP to tele-rehab now. So all these things, right? And then everything being digitalized in the EHR and working on those outcomes and not saying that we provide a nurse or we provide a physio or we provide a equipment or an OC. It's managed care in a hospital outside the hospital. So that's differentiates us. As I said, our business support office is in Noida, but we have our sub offices in Chandigarh, Mumbai, Bangalore, and Kolkata, and then another 70 places where we would have presence. This is something which was a need of the hour. Now I was flooded with calls. घर पे ICU बनाते हो क्या? क्योंकि hospital में ICU नहीं है. But I think when we started this 6 years back, the need was that prolonged care in ICU is good for no one. It increases more beds in a hospital. It decreases cost for the patient and is a win-win situation for everyone, where we started doing ICU at home almost 6 years back. And we have done a midnight occupancy of around 100-150 beds pre-COVID area. Outcome-based rehabilitation, where people talk of acha physio aayega, kuch karega aur ek machine lagayega. We started speaking of various types of scores and outcomes and even benchmark them. And now in the COVID era, daycare like dialysis at home or infusions at home or oncotherapies at home, all this which we were doing pre-COVID only, COVID just ushered into it. We are, I think, the largest provider of disease management and specialized drugs across the country and work with many MNCs. But I think this is our biggest differentiator. जहाँ लोग बोलते हैं nurse की quality क्या है, physio की quality क्या है, अच्छा कैसे करते हो? We have now 19 publications in peer-reviewed journals authored by me and my team, where we have benchmarked ourselves against the world data. So we are the only provider in India which talks of readmission rates against USAID rates in USA. It got published in American Journal of Nursing Sciences. We talk of our OA outcome rates, osteoarthritis outcome rates, which got published in Japanese Journal of Physical Medicine. And the first of its kind experience of home-based critical care got published as a chapter in Critical Care Update 2018. So we have upped the game in terms of clinical credibility and people telling that we are credible rather than we voicing for ourselves. So COVID last year, same time, I wouldn't say same time, when the first lockdown happened, we were flooded with queries. Kya hota hai? Kaise hota hai? Kya karoge? And the best thing was to bring up a helpline. Now on the helpline, you wanted to talk to a medical doctor. Because before this, it was very easy to go to the doctor, very easy to go to a neighborhood doctor. Ab fever ho gaya, you just can't sit by popping up a crocin. So what we started was, we started a doctor teleconsultation. And that teleconsultation forayed from GP to specialist, to pulmonologist, to EICU, to psychological counseling, to tele-rehab, nutrition, all these things started happening on that portal. And then once the doctor was writing the prescription, the first thing was test karao. You need to get a COVID RT-PCR done. And in this wave and that wave, it was a huge difference. But what we started was home sample collection of COVID RT-PCR, which we ramped up to almost 10 cities there. Post that, if you are positive, what to do? Kya kare? How to isolate? How to treat myself, my kids, my family, my parents? What if they get it, right? So what we started was remote monitoring. May 2018-20 is when the guidelines came by Ministry of Health. We adapted that into a program which we ran with Fortis across India. And then as the numbers started increasing, we were doing this home isolation for government of Delhi, government of Karnataka, and government of Punjab for lakhs of patients with a 96% of recovery rate. And I tell you, at that time, we felt that we had done a humongous job at keeping all these patients outside the hospital. We didn't even know what is going to strike us in the next March, same time. So fever clinics, screening, bringing back people to job, screening of industries, factories, corporate helplines, all this we did, which we never used to do in the pre-COVID era. Well, the impact was great. The numbers were huge. The life saves were huge. And hence we got rewarded the Excellence in Home Healthcare by FICCI Healthcare Services Award, which is one of the most prestigious awards in the country. As I said, we worked with the governments. We did a helpline as a CSR initiative, Jan Helpline in Mumbai, Pune, and Indore. Worked with many corporates. Set up an isolation center at that time in Supreme Court of India. Handled the Vande Bharat people in Shangri-La. But I think one of the most impactful things which we did was to have multiple webinars with best of the clinicians across the country. This number has crossed 100 now. 10 lakh and more people like in these webinars could understand and talk to most credible and authentic people in the industry across the country. And that is where we were able to allay the panic around this whole disease. And we still continue this effort. But this year, we had to set up an isolation program in a hotel also because there was no beds. People between 80 to 90 saturation, where do they were roaming around and around in ambulances, finishing. So what we did was we took up hotels in Gurgaon, put up oxygens, put up doctors, put up nurses, and we said, okay, let's create capacities and save more lives. We were able to save 200 lives in one week when our phone was so much flooded and everybody was looking for a hospital bed in Delhi NCR. We extended the same in Mumbai, Bangalore, and Kolkata also. So this was the facility. Again, another thing on that. Then what we did was that how your own RWA, you can build up a facility, which could be a holding facility or where mild or asymptomatic patients can also be treated, right? From education to training of resources, to equipping people, to running the facilities. When there were no OCs, we launched the whole campaign of donate a OC and save a life. That worked very well for us because we got OCs when nobody was getting OCs, and we were able to save a lot of lives by putting and conserving all energy into that hotel facility. Doctor teleconsultations, we ramped it up because it was going out of the roof. There were many doctors who volunteered free of cost to come and work with us, and we were able to pass on the benefit to the patients, right? And in all this chaos, we also wanted that the non-COVID patients should not suffer. So again, stroke care, care of COPD, care of dialysis, chemotherapies, all that also went accordingly. And we were also propagating that to enroll for vaccinations. With Fortis, we were even doing vaccination camps outside the hospitals so that more and more people get vaccinated. So I think the wave in Delhi is getting down. We have again resumed our ICU at home services for people who are getting out of the hospital. We always tell people ICU at home is not a replacement to somebody getting into an ICU into the hospital, but we can get you out soon so that that bed can be used for somebody else who is in a better need of that bed. So that's what I wanted to project. We at HCAH are a hospital outside the hospital, and life changed for us and for many people like us during these COVID times. I think the first wave was nothing compared to what we were experiencing in the second wave. I hope we have no more deaths and no more waves. You're on mute, Adil.
Thank you so much, Dr. Thukral, for sharing the great work HCAH is doing. And I think on behalf of all of us, we are grateful. Would like to now get into sort of, why don't you, given the immense amount of experience you've had, sort of, how does that to begin with? If you can just talk through the journey, how does one figure out that they've got early symptoms? How do you not confuse normal fever? Because this is season changing, there is normal flu around. So how does a common man not panic and differentiate between a common cold and a flu and something which is COVID related? So what should the protocols be around that? And if you are you do have symptoms which you believe, what should one do? So let's start with sort of the journey. How do you figure out yourself when you do a test? Nowadays, tests are taking a long time. So what has been your experience and what is your advice on that front, Doctor?
So, Atul, I think this virus has been a very, very dynamic virus, much more dynamic than what we all have been together, right? It has been mutating, and the symptoms which we were seeing in the last wave are very different from what are there in wave. In last wave, if you see, there were more of elderly people dying. This time, the more serious effects are happening with young people, right from 25 to 45, and even children are getting infected. So the whole dynamics of these symptoms, or do I have COVID, has also changed. Why it is happening more in children is because of the change in the strain itself. Why it is happening more in young is because the young one, they were not vaccinated, right? The elderly were, so they still had some immunity. And in the young, what is happening is that the immune system is strong. So that immune system itself is fighting the virus, and in turn, it is also causing harm to the body. So we are not even fighting with the virus or the harmful effects of the virus, but we are also fighting with the harmful effect of our overzealous immune system, which is as it's supposed to be in younger individuals. So that's a problem statement. Now, first of all, I would say that masking, social distancing, and hand hygiene, which was being followed very, very diligently last year when people were really frightened. Over the year, people thought कि अब तो कुछ होना नहीं है, मास्क पहन के क्या होना है, तो मास्क नाक के ऊपर लगाओ कि नाक के नीचे लगाओ, कोई फर्क नहीं पड़ता है, चलो 2 बार हाथ धो लिए, चौथी बार नहीं धोए तो फर्क नहीं पड़ता है. All that callousness got us into this situation. Coming to a fever, now people were, yeah, ठीक है ना, fever ही तो होगा, मौसम change हो रहा है, अभी तो आ गया, right? And अगर हो भी गया COVID, तो मुझे क्या फर्क पड़ रहा है? I'm a young guy, right? Nothing is going to happen to me, right? I'll be asymptomatic, right? And then there were various other symptoms like stomach ache, like rhinorrhea, or coughing, or diarrhea, and all these things. So people were very confused whether this is, and the worst part which people started doing was not to get tested. Why to get isolated for 10 days? Why to get isolated for 2 weeks? How will I manage my work? How will I manage my family if I get isolated? And another worst thing which people started doing was to replace a RT-PCR test by a CT scan test. चलो एक काम करते हैं, CT scan करा के देख लेते हैं, अगर उसमें नहीं आया तो फिर तो बिल्कुल ही नहीं होएगा, right?
Sorry, Doctor, sorry to interrupt. Can I request one thing? Apologies for this. Can we stay with English? A lot of our audience actually is, I apologize for stopping you.
I thought
I understand Hindi's comfort, but yeah. Sometimes emotions come out much better in Hindi.
Yes. So people starting reducing testing, switching RT-PCR with the CT scan, which was never mandated, right? Taking their symptoms and the whole situation lightly. And that's where we landed up in such a chaotic or unprecedented situation where the whole healthcare system was overwhelmed, right? So what my advice is that if you have any kind of symptoms where you feel that you are not well, first of all, please contact your doctor, right? The doctor has put up so many years of experience and is continuously updating himself on various types of symptoms and strains of this virus. So first thing is, please reach out to your doctor. Second is, if the doctor has advised an RT-PCR test, please get it done without fail. Do not delay it. Arey 2 din ka fever hi to hai. It's only 2 days of fever. We'll take it after 4th day. I'll get a CT scan done after 6th day. Please don't take your own decisions. Please do not self-medicate. Again, let your doctor decide what is the medication. These days on a WhatsApp, there's a prescription which you'll get on a WhatsApp which has doxy, azithromycin, vitamin C, zinc, and whatnot. And in a group of doctors, we were discussing that this virus is good for eradicating scurvy and zinc-related other deficiencies rather than on its own. So please do not self-medicate. Let your doctor write the prescription. If God forbid you're positive, please understand that you need to isolate yourself. Please follow the isolation guidelines as strictly as possible. In isolation guidelines, you need to be in a room which has a separate bathroom. If you don't have that facility in your home, there are dedicated hotels which are isolation facilities. There are government isolation facilities also. In that room, please clean all the surfaces which are frequently touched with 1% hypochlorite. Please dip your clothes for almost 4 hours in 1% hypochlorite. while you are flushing when you're flushing your commode, please put the lid down, because there are aerosols which come out of it. You should not come in contact with any family member face to face. They should keep your food in disposable utensils outside the room. Tell that person to go away from the door, then open the door, wear your mask, get the food, dispose of all the things in one bag, and do not take out that bag multiple times in the day. There should be fixed frequency of one day. Again, put that bag in 1% hypochlorite before giving it out to the biomedical waste people, and you have to label it as COVID waste, right? Measure your temperature and your SpO2 3 times only in a day. Learn by videos how to use a SpO2 probe. Because today, the biggest panic is it has become a mathematical thing. This is my CT value of RT-PCR. This is my CT scan value. This is my SpO2. This is my temperature. I should be here. You are no one to decide that. What in your hand is to keep your sanity, follow all the isolation protocols, only look at your SpO2 meter and thermometer 3 times in a day if you are absolutely fine, if your symptoms are not aggravating. When you're doing an SpO2 probe or saturation, do it once at rest. After that, do a 6-minute walk by the watch and again check. And if your saturation is above 95, nothing to worry. Take rest. Many people are doing their jobs. It is work from home. I was doing it in that room. Now I'm doing it in isolation. It has a toll. The respiratory, the fever takes a toll on you. The respiratory symptoms and cough start aggravating on 7th, 8th day. And we do not realize that we have lost a lot of energy because of that, right? So do that. Excess of everything is bad. So if you are now doing a lot of kadas, I'll have a kada in the afternoon, in the morning, in the evening, it's not going to help you, right? 1 orange a day is as good as what vitamin C you require. Try to take a high protein diet. If you can take 2 eggs in a day, it's good. If you're a vegetarian, increase your pulses and your cottage cheese and other things which you can, soya, with your protein diets. Keep your sanity. It's not easy to be in one room without any touch for 10 days. And you can come out of 10 days if you are afebrile for the last 3 days. If not, then you are not supposed to come out, right? And this virus has been such a strain that if it has entered the home for one person, it will infect everybody else. And there what people are trying to do is, now everybody is infected, so let's stay again together. No, the infectivity can be different for different people, right? So in that case also, elderly should not be allowed to mix with the young ones. Yes, in children, you don't have a choice. You have to be with children. So you can definitely get them at one place. But for elderly, please keep them at bay. Be in touch with your doctor at least once in a day, or any healthcare provider team, right? Watch out for warning symptoms like headache. It could be you're feeling dizzy, your respiratory rate or feeling breathless more than 24, saturation going at room air below 95, any signs of bleeding. So what this virus is basically doing is, one, it is a multi-inflammatory. It is trying to cause inflammation in the body. It is very specifically trying to involve the lungs. And once the body is fighting against this virus, there are side effects which are happening to the body, where people start, so the doctors are recommending that if after 7 days, you still have fever, then there are blood tests which needs to be done, which shows that how your immune system is fighting the body. Now there these very specific tests of CRP, D-dimer, ferritin, IL-6 are being done so that we can subdue the immune system by giving steroids. Otherwise, that immune system will lead to other organ damage also, rather than only eliminating the virus. Now, there is a lot of misuse of these tests also happening. There's a lot of misuse of steroids also happening, which again, I'll request the audience not to do on their own. Please have full faith in your doctor, all right? Listen to him. And I've also had instances where people have consulted 4 doctors and got more confused on what to do. Please don't do that. Believe in one doctor, believe in whosoever you want to, but all these things will not lead to good outcomes. So that's everything which you need to do to be safe at home.
Thank you so much, doctor. I mean, given that we're money managers, I think the analogy we always say, trust the expert and trust one person. Doctor was giving me, and I was talking to him earlier, he was giving me an example that one of the patients who reached out to him had 4 different prescriptions from 4 different doctors. And it obviously confuses the patient. I mean, again, you need to figure out who to trust. But yeah, trust your family doctor the best. Look after yourselves. Doctor, now I'll move on to some questions. So I'll not get into clinical care yet because that's a separate set. Within the home care environment, there are questions around the use of oxygenators. When should you use one? If you use it yourself. So can you just talk us through home care oxygen? What are the protocols? What should one person do? And if there are 3 people infected in the house, can you use the same oxygenator for the 3 people? So something around those would be great. Just to repeat what doctor said, consult a doctor as soon as possible. Don't rush and do a CT scan and start doing lots of blood tests. Be careful of the tests and isolate. And isolate totally, don't make it casual. So that's what the learning from us is, just to repeat for our customers. Over to you, doctor. Talk to us about oxygen care at home, difference between an oxygen cylinder and oxygenator, and the utility and how do you use them. So effectiveness, etc. That would be really useful for us, doctor.
Yeah, so Atul, I think oxygen concentrator is the buzzword these days, right? I haven't seen such a hype around. We have been working with the oxygen concentrators, which I will call OC, for the last 9 years, doing ICUs at home using them, right? But the amount of demand and the panic which I have seen in the last 1 month is unprecedented. So let me first explain why do we need oxygen, right? So because this virus is infecting the lungs, right? It causes a pneumonia in the lung, right? When it causes a pneumonia in the lung, the whole interface of lung being the organ which will give oxygen to the blood gets disrupted. That means you need additional support to get oxygen to the blood, because that is life. That is the energy which the blood gets and gives to the cells so that we can do whatever we want to do, right? Now, when this gets disrupted, that's where the role of oxygen supplementation comes. How do we check it? Through the pulse oximeter. What does the pulse oximeter do is, it looks at the oxygen in the capillaries. So it can be used on your toe, it can be used on your finger, it can be used on your ear lobe also, anywhere where you have a good capillary load. So capillaries basically tell you what is the oxygen concentration in the blood at that time. As per the Government of India guidelines, 95 and above is absolutely mild asymptomatic to be at home, right? But these 95, so people now what they think is, as soon as it goes below 95, I should be in the hospital. Now, this was possible in the last wave. This became impossible in this wave. And hence people thought that if they have oxygen, it will be a life-saving thing. Where the whole thing went wrong. Now, what is an oxygen concentrator? It is a machine which creates or manufactures oxygen on its own. So that means that machine will keep on creating oxygen, right? And that machine can be plugged into the electricity. Through a mechanism, it will create oxygen, and there is no requirement of refilling it. You don't need to take it to a plant to refill. As contrary to an oxygen cylinder, which will finish off as per the dial, and you have to get to the hassle of refilling it. Now, oxygen concentration as oxygen cylinder has the limitation of that it will get empty and has to be refilled, which is a very big hassle process in all these dynamics. Oxygen concentrator also has a limitation on the airflow. So at room air, we are saying that above 95, we have to be okay. But an oxygen concentrator starts anywhere from 2 liters to 5 liters to 8 liters to 10 liters, right? And that is the various level of oxygen. But you cannot be sure that if you are maintaining on 2 liter or 5 liter, you will not get to a level of 10 liter and in how much time. That means that if you need oxygen, right, then you, beyond a point, beyond 5 liters, you should be in a facility which can give oxygen as good as 25 liters per minute also. And that is the kind of oxygen which is pushed through either a BiPAP or a ventilator. So the oxygen requirements, and then still your saturation can be 65, 60, 70. That's the cases generally which we are seeing these days. So an oxygen concentrator can be a rescue mechanism only if you need less than 5 to 8 liters of oxygen per minute. At any point of time, if you become a candidate of not maintaining above 90% of saturation on these concentrator also, you are a candidate where you need high flow oxygen, maybe through a nasal cannula, maybe through a BiPAP, or maybe through a ventilator, according to whatever your doctor decides as per your condition. And you need to be in a facility which can provide these things. So that's the whole oxygen dynamics. But having said that, it is not only the oxygen which saves you. As I told you, there are multiple dynamics to it. It's not only the saturation which is happening, right? The blood test which now needs to be done when your saturation is filling, your fever is not settling, the medication changes which have to happen despite the whatever your blood test is telling or your condition is telling, is not something which will solve by just getting oxygen concentrator. You need to be managed. Your loved one needs to be managed, which has to be done under the care of a qualified doctor. So just getting an OC does not save a life. It might save a life because it will give you that time. And if you are lucky enough, your saturations will come back. But all this time, you have to be under the care of a qualified doctor.
And Doctor, what's been your experience that given this, as you said, there was this panic around lots of oxygen concentrators being procured by people sort of hoarding them. I've heard of stories in Delhi, people keeping 14 oxygen cylinders at home that I need them for 14 days. But leaving that aside, what's been your experience? Are people able to manage with obviously the due doctor's care with an oxygen concentrator at home, so they don't need to go to a doctor? Have you seen cases where the patients are able to self-care, take home care themselves, obviously under supervision, through an oxygen concentrator, or does it always end up in a hospital?
No. So in our experience, and we were running an oxygen facility also, right? So in our experience, if the patient is being managed properly, knows how to run the oxygen concentrator or the cylinder properly. And in this time, what we did was we made videos and percolated them to everyone to say that please get the authentic information and don't use wrong and do wrong to yourself. But if you are under the care of a doctor through telemedicine, who's guiding your medication, who's guiding your diagnostics, who's looking after your condition, and as I said, you need oxygen only up to 5 liters. There were many people who were able to save the whole hassle of going to the hospital because hospitals didn't have bed. And in our own oxygen facility also, I think our admission rates were less than 5%. We had a full-time qualified doctor. We had an EICU team looking at them, full-time nurses, proper monitoring being done. And with 5 liters, only 5% people escalated and landed up in the hospitals.
That's good news, doctor. I just wanted to get a sense of that yes, you can get a concentrator when required and share it to other people when you don't need it. The other question is around, now that you've recovered from this and you've taken home care and you're out of isolation, what precautions should an impacted person continue to take? Are there any other symptoms they should watch out for? Because we've heard of mental fog, we've heard of extreme fatigue, we've heard of different people react differently. But what's your advice on what to watch out for? When, if at all, to press the panic button, or what do you expect will happen? So how do people look after themselves and their loved ones?
So there is this post-COVID syndrome which has set in now, right? If I talk from head to toe, it is affecting almost every organ. So right from neurological symptoms to cough, which prolongs for almost 6 weeks post-COVID, right? What people are doing is, very interestingly, again, they'll get their test done and say, now I'm negative. So why the hell I should have symptoms? But the virus does not understand that, right? The negativity is that the concentration of the virus is gone below a level which cannot be detected or which cannot be infective. But people think that once they're negative, the virus is exited, tata bye-bye, now nothing is going to happen. But there are many, many lingering things which are happening, right? From respiratory symptoms, fatigue, as you said, depression, right? People who have lost their loved ones and were also infected post-traumatic stress disorder. So neurological symptoms, mental illness, fatigue. Then in the blood test, what we are seeing at this time is that many people, so another thing which this virus does is it makes the blood thick. Hence, there are people who are dying with heart attacks also, with kidney problems also. So there again, we are seeing that there's a prolonged anticoagulation which is required. Due to the whole thing of that immune system going haywire, there is a prolonged steroid which is required. So my recommendation is that you should be in touch with your doctor. If there is any worsening of symptoms, please speak to your doctor. Maintain again your sanity. If you have to see a psychologist, please do that. There's nothing wrong in seeking help for mental health, right? Take your work slowly. Just don't start doing everything the very next day. If you had gone from moderate to moderate symptoms, do deep breathing exercises, get to your gym routines or exercise routines gradually, have a high, again, I would say, fresh diet and a high protein diet. Do not discontinue that. Do not overdo supplements and vitamins. Some people are taking five vitamins a day that I'll get fine. And watch out again for your temperature or worsening of any symptoms. It is taking, as of now, anywhere between 6 weeks to 3 months for people to get rid of COVID syndrome. And then there's a COVID lingering syndrome also, which is going even beyond that.
Thank you, doctor. So yeah, I think people who are impacted would benefit from this advice and this protocol. The other panic we've seen, or at least like you were talking about medication. So remdesivir or ivermectin, just the number. I mean, all of us have become doctors, looks like, thanks to the WhatsApp University. And the number of panic sort of messages go out. What's your advice on that, doctor? Because you hear different things. Somewhere you read that it's ineffective. WHO has said this. CDC said this. ICMR is saying something else. And how much of it is true, false, we don't know. As a doctor, what is your view on something like remdesivir?
So Atul, when I was doing my MD, we used to have this textbook of medicine called the Harrison's textbook. That was a Bible or the gospel for us to read, right? Every line or every chapter which was written in that book was based on evidence of years. Any drug trial, anything which will happened over years, right? And hence and that also was evolving, changing. Every new edition, things would change, right? Now here we have a disease which didn't give us any time. HCQ was the queen. Hydroxychloroquine was the queen of the pandemic last year, and you don't even see that medicine anywhere. So what the doctors and the scientists were left with repurposing a drug with treating COVID. For example, remdesivir was being used to treat Ebola. They said, okay, let's try it. Will it work here or not? Similarly, plasma therapy was an experimental thing. Similarly, whether doxy would work or an azithromycin work, doxy is an antibiotic. Azithromycin is an antibiotic. Ivermectin is an anti-helminthic. It is for cleaning worms, right? None of them was ever tried for COVID specifically. But then when doctors tried them, and there were multiple short-term trials which were done, there were some results seen and some results not seen. And now if you ask me, I'm not a hardcore clinician, but if you ask me, there is no scientific evidence to any of these drugs as of now. Dr. Prashanth Reddy would have been a better person to tell you because
he's joining us. The good news is, unfortunately, Dr. Reddy is just joining us.
There is no evidence to all of that. These cocktails are being tried. They have worked for some, they have not worked for some. What is wrong amongst all this is two things. One, people self-medicating and doing wrong to themselves. Second, some over-enthusiastic doctors also use this wrong. What is there?
Dr. Reddy, good afternoon to you, and thank you very much for joining us.
Sorry about that. I had an emergency mucormycosis case. That's the black.
Absolutely, yeah. We are so grateful you could join us. To the audience, Dr. Reddy is a practicing surgeon. He's been kind enough to take time out from a very busy schedule to join us. He also happens to be an MBA, helps with the NSR cell, helps with health tech companies, so extremely knowledgeable. And he's been kind enough doing these webinars to help people understand how to handle COVID. Doctor, you came in at exactly the right time. We were just talking about the effectiveness of remdesivir or the multiple sort of cocktail of medicines which seem to be sort of prescribed or very often by the WhatsApp University. What is your advice on that, doctor?
So remdesivir has been proven time and again that it is nothing but a placebo. Unfortunately, let me put it another way, that it is basically useful in only the initial period of a mild symptom. The moment someone requires oxygen, that's when it is best utilized. If people have not got remdesivir, they have not died. Let me put it that way. People who have not got remdesivir have not died. But unfortunately, people who are running behind remdesivir for their loved ones are dying because of them getting exposed to COVID. when they're in the panic mode and when they're running behind this so-called silver bullet, which unfortunately is not. Even today's in the newspapers of Times of India, they have given in Madhya Pradesh, 90% of all the remdesivir vials which have been sold are fake. But then too, people have not died. That means remdesivir is not at all useful. They have given a fake drug under the brand name of remdesivir, and people have still survived. That means remdesivir is of literally no use.
Thank you,
With that
doctor.
said, the mortality of remdesivir is more than what is helpful. So people who are going and running behind this plasma, tocilizumab, and remdesivir, they are dying because of getting COVID. So kindly don't panic and run behind this absolutely useless drug. Literally, let me put it that way.
Thank you so much, doctor. A couple of questions around the oxygen levels, Dr. Reddy and Dr. Thukral, like in order to answer that question. So suppose, my SpO2 levels are at 90 to 93. Does it mean that I need oxygen, or does it mean that if the doctor is telling me home care and just do your breathing exercises, so what is the protocol that you're at 93 or 92 and you're about that level? So is it necessary that I get onto oxygen immediately, or can I just take medication and hope it gets, or not hope it'll get better? What is your experience and what is your advice? Dr. Reddy and then Dr. Thukral.
Yeah, so when a patient is at 93, 94, that means the patient is entering a critical stage of the illness. So 93, 94, we need to assess whether the patient is checking it in a correct way. First and foremost, we need to ensure that the oxygen saturation measurement pulse oximeter is flipped in correctly. Number two, we need to assess if at all the extremities are cold. So if at all the extremities are cold, it will lead to a wrong reading. Number three, if at all the extremities are wet because of any sweat, so you need to wipe that off before you measure it. And also you need to measure the SpO2 level once you are walking around for 6 minutes. So when you're walking around for 6 minutes, your body will also warm up and will also know that if at all you're getting breathless. If at all you're getting breathless, that means that it is high time that you initiate your conversation with your treating physician. Whoever is treating you at home, initiate a conversation with them. At the same time, do proning. Don't get panic and searching on helter skelter for oxygen concentrators or for oxygen cylinders. All you need to do is prone and breathe deeply. That will ensure that it will raise the oxygen saturation back to almost normalcy. And in the meantime, do contact your treating physician so that they can take a educated understanding and also a proper clinical estimate as to what exactly the patient is happening. Based on that, they'll only advise whether they need to shift to the hospital or still we can maintain it for some more time at home.
Okay, doctor. Thank you very much. Dr. Thukral, you want to add something to that? You're on mute, Dr. Thukral.
I think Dr. Reddy has covered everything. Only thing which I want to emphasize is prone positioning. That is something which is really helpful, and people in the panic, they don't want to do that. In fact, the whole sense is that if I am now lying on my chest, it will exert more pressure on my chest and I will not be able to breathe. So people have cooked up their own hypothesis about proning also. But what I have seen in my practice also, that proning really helps in that dicey 90 to 95. What has happened is that the government guidelines still clearly say 95, but you don't have anywhere else to go, right? Now, the only thing which is helping people is either wrong measurement, which he very clearly said that you're measuring it wrong and hence you're panicking. Or the second thing is, please go prone. If you're going prone, again, it is coming from that 90 to 93 to above 95 and people are settling again. So that's my advice. Please do proning. Do not have your own hypothesis around proning also.
Thank you, doctor. So now we'll move to the topic which is on everybody's mind now that vaccines are there, and I'll not get into how bad the situation out there is. But if you were to get a vaccination, 3 questions, and you can answer them in any sequence. You've had COVID, have recovered. How long should you wait before you get the vaccine first? Which is the clinical advice, not the government guidelines. I don't want you to counter them. The second is what is the right time window between the first vaccination and the second one, from 4 weeks to 8 weeks to 12 weeks to 6 months. Everybody's got their own views. And the last question on this guideline, that if you are double vaccinated, the US has just announced that if you are double vaccinated, you don't need a mask. So because your chances of contracting COVID, both symptomatic and asymptomatic, is negligible. Now, this is very confusing for the people. I mean, obviously, we want to follow SMS, which is sanitization, masking, and social distancing. That said, what is your advice about post-COVID, gap between two, and lastly, if you are double vaccinated, what does it mean for you? Dr. Reddy, you want to go first, and I'll hand over Dr. Thukral.
Yeah, so basic thing is people need to get vaccinated. It doesn't matter. So once people are vaccinated, doesn't mean that they're immune to the virus or getting an infection. So that's a wrong understanding. Unfortunately, people need to understand that once they are vaccinated, masking is essential. It doesn't mean that you are immune to or you are resistant to getting an infection, either asymptomatic or symptomatic. Because the reason behind that is you are basically injecting the virus. It is not going in through the natural orifices of the nose, where the virus is actually getting entering into the nasal is through the nose. So people have to wear a mask even after a single dose or a double dose. It's basic social responsibility. And also, most of these governments have told wearing a mask outdoor is not required, but they have not mentioned that no masking indoor. The main spread of the virus occurs indoor. Kindly note that. So on this point, let me emphasize that wearing a mask indoor, especially if you're in an apartment complex which has a COVID case, is much more better than you not wearing a mask and staying indoor. The reason behind that is in a closed apartment complex, the chance of you getting infected is much more high. And the third point, what is the interval between each dose? So since it's an ongoing research, we really don't know what is the actual correct clinical evidence-based trial. Because as we know that the vaccines just arrived this year, we really don't know. It's not even been 1 year to assess how much of one shot or two shots are required to give you a prolonged immunity. So with the recent onset of Pfizer saying that we can delay the second dose to more than 3 months. But that being said, we need a lot more research. I can't comment on a clinical standpoint saying that, okay, this is more than sufficient, that is more than sufficient. No, I can't. Unfortunately, I can't right now. So let's go with what government is saying. Let's not create more panic. And the point about when to get vaccinated after having COVID. So even right now, what has happened is the government has again gotten the protocol saying that we will have to wait for 6 months if you've got infected with the COVID infection. So that again is another clinical trial which we still don't know. Unfortunately, there are a lot of unknowns with this COVID infection because it is still a very, very new infection. So so that's the thing. So as far as the previous consideration, 28 to 4 weeks to 6 weeks was the recommended thing. But now we really don't know. We need to wait and watch till see how this disease progresses. So in the meantime, masking up is the best way. So it doesn't matter if you're vaccinated, not vaccinated. Masking up is the better way to go. You can see me how I am right now.
Thank you very much. That's very useful. Dr. Thukral, you'd like to add to that?
Yeah, I'll just add very clearly 3 things which Dr. Reddy mentioned. First opportunity and you're eligible for vaccination, please get vaccinated. No ifs and buts. All the people who were still considering that there will be herd immunity which will happen and I will be automatically get covered, have suffered a lot in the second wave, right? There were healthcare workers who were given on platter in the first phase, they didn't take it and they have really suffered. So please take the vaccination without any ifs and buts. That's the first thing. Second thing is government is putting up guidelines after a lot of experts, research, and whatever best is available. Please follow that to the toe. Till date, it is Covaxin 28 days, Covishield now saying 12 weeks, right? And there are still guidelines around after COVID infection, as Dr. Sab said, 4 to 6 weeks. It might change to 6 months, but as of now, please go through what the government is updating on their official website. Do not make your, I am again saying, do not make your own hypothesis on what is right and what is wrong. There is a lot of effort which the government is making on getting everybody vaccinated. There are a lot of reasons behind why these guidelines are coming, and none of us are capable to challenge it, right? So that's and I think the situation will get eased in, as we see in the newspaper today, should get eased in another 3 months' time. As soon as the market is flooded with vaccination, first opportunity, get yourself vaccinated. Don't even think which one. Whether now I want to choose a Covaxin or a Covishield or a Pfizer or a Sputnik, whatever you get, please take it. I'll give you my own anecdote. When I went, I got a registration, and within 2 hours, I was in a hospital to get myself vaccinated. I didn't even look at what. So when at that time, Covishield, this was early Feb times. At that time, Covishield was the queen, Oxford, UK, and all that, right? And when they were, the nurse was going to inject me, just before that, she said, "Sir, I'm going to give you Covaxin." And the Covaxin was still in trials. And I thought for a second, I said, okay, let's go ahead. By the time I was getting my second jab, the same day, the newspaper said that Covaxin efficacy was better because it was a whole virus attenuated. And 1 month in the doctor circles, in my own circles, I was the lesser have. Yaar, tumhe Covishield nahi lagi, chalo koi baat nahi, it doesn't matter. And in 1 month, I was propelled to a thing of the elite club. Oh, you were the one who got the Covaxin, right? So nobody knows anything. Whatever vaccine you get, please get it. At least there is some form of immunity which is getting into you. Do not take the vaccine, and whatever you get, whenever you get first opportunity, take the vaccine.
Thank you, doctor. That's very, very useful. In the interest of time, there are a couple of questions around the new black fungus or microsis. What is your view on that? And how serious is it? Is it another panic? And how can it be prevented? So especially for people in home care, I'll not talk about hospitals because I'm sure the doctors will take care. If you're in home care and you've been, how often is it happening? Any thoughts on that, Dr. Thukral, and then Dr. Reddy?
So I'll tell you very clearly that all the things which are leading to this blast of mucormycosis are happening in the hospital. There are only 2 things which are leading to mucormycosis: excessive use of oxygen and excessive use of steroids. And frankly, this excessive use is, as of now, only in patients not being seen, right? But this is not a new disease. It was always there. Only rampant use, irrational use of oxygen and steroid has got it out of, and then it's our lovely WhatsApp University which has further propagated it, right? So my advice, I would leave Dr. Prashad Reddy to talk about it, but my advice would be again the same: consult your doctor, do not self-medicate, do not overdo things, and if you have mucormycosis, it is treatable. It's not that it's the end of the world, right? There are many ophthalmologists in this country who have been treating it for ages, right? It will still get treated. I'll leave Dr. Prashad to talk about the hospital setting.
Yeah, so interestingly, that today's case, which I operated just now, the patient is getting extubated. So that happened to be a mucormycosis. And yesterday night also till midnight, I was operating a mucormycosis case. So basically, mucormycosis, why it is occurring, why there is a sudden blast of mucormycosis like a cloud burst. The main reason behind that is uncontrolled diabetes. People are working from home and they're not gotten themselves tested. They have become sedentary. Secondary to which, they have got pre-diabetic conditions. That means when they are at the verge of developing diabetes, or people have already got diabetes. Because they have not diagnosed themselves correctly, because of COVID requiring the life-saving drug called steroid, the dose will definitely increase. When steroid is given, that will also increase the chance of hyperglycemia or the diabetes going helter-skelter. Secondary to the diabetes going helter-skelter, the mucormycosis, the spores which are there everywhere in the air. So that will be, it will be inhaled by these people. And because the blood sugar levels are so high, that will lead to immunocompromised states, and that will lead to these people developing mucormycosis. And mucormycosis, the only entry point is through the nose. So through the nose, it will go into the eye, it will go into the brain. Mucormycosis is a very, very rapid disease. So that's why we have to operate it at an early stage. And once we catch the disease in an early stage, we can operate and take out the whole fungus and save the eye, save the life. So, what are the classical features of mucormycosis? First and foremost, you'll have pain underneath the eye or behind the eye, or severe headache. So, kindly visit, get your CT scan.
Doctor, you've gone on mute suddenly. Doctor, you've gone on mute.
Yeah, I got a call, so in between. Yeah. So because of this sudden rapid, change in this, what do you say? Because it's very, very aggressive, we need to address it very fast. So we need to get a CT scan and MRI scan to assess what and all is involved. If at all the eye is getting involved, through the nose, we can go and operate on the eye and take out all the mucus, the black fungus. That's what I just did right now. So if we let it go, it will progress so rapidly that we can't save a patient's life, even if we operate and even if we do everything. So ensure that you are checking your sugar levels. That is the main takeaway from whatever I just told. Check your sugars, get yourself tested. Even if the doctor might miss it, just ask the doctor, kindly get my HbA1c done. Why HbA1c? We'll get a overall period of 3 months to see how the diabetic profile was over the past 3 months. It's a glycosylated, or the hemoglobin of the blood will get, the glucose molecules get attached. So we'll get a profile over 3 months time. So that is very, very essential. Get your HbA1c checked, and kindly inform your doctor that this is the level. With that, the doctor also will have an eye that, okay, the patient has diabetes, and then we can have to take care of it. That is my only advice for people who are at home. And once the patient is at home on the hospital, ensure that they are they tell the doctor the symptoms: eye pain, headache, cheek pain. Very, very essential.
Thank you very much, Doctor. Yeah. So again, no need to panic. These are treatable. Watch out early. Last couple of questions in the interest of time. There's this whole thing about false positive and false negative, right? False positive, obviously, you can't do. I mean, both you can't do much. So you're feeling unwell. You got the symptoms of fever and SpO2, say at 92, 93, but it shows a RT-PCR negative. What should the person do? Because anyway, it'll take 3 to 5 days for the test to come back again, even if you take a test again. So what should if I feel I'm not feeling that well, and I'm seeing the symptoms, what should the patient, or not patient, but what should the person do, Doctor? Dr. Reddy and Dr. Thukral, your thoughts?
Okay, so first and foremost, if at all you have any symptom, assume it to be COVID. In this pandemic, there's no other thing other than COVID. Until unless it's been proven beyond a doubt, saying that it is not COVID, assume it to be a COVID. This is especially for people who are with family members who have just turned positive, or who are showing symptoms. This is a major difference between the first wave and second wave. In first wave, only one family member would be positive, and then they could have isolated and they would have been safe. Unfortunately, that is not the case with the second wave. If one person turns positive, we have to assume all the members are positive and take the appropriate measures accordingly. Kindly consult the doctor and ensure that you are safe. Ensure and inform the doctor. That is very, very number one priority on the mind. Talk to the doctor. Don't assume you're negative. Any symptom, be it headache, be it fever, sore throat, even little bit of cough, kindly consult a doctor. It might sound irrational, but trust me, it's better to be safe than sorry.
Thank you, Doctor. Dr. Thukral, anything to add to that, or?
No, I'll just add that every test has a sensitivity and a specificity, and COVID RT-PCR has a specificity of 70%. That means still 30% of the patients in that test would get missed. And as I was also telling you, and Dr. Reddy has also told, this virus comes with the varied symptoms. There is no rule book. This virus is following. If you have any problem, please consult your doctor, the doctor which whom you trust, whom you are not going to again doubt and consult another doctor and let him take the course of action. This virus is infecting everybody in the family, right? So the test might be negative. Don't replace this again with a CT scan. That agar yahan pe negative aa gaya, to chalo CT scan we can get done. Don't do that. Please talk to your doctor. Believe in your doctor, and he will do the best for you.
Thank you so much, Dr. Reddy and Dr. Thukral. In the interest of time, we've answered most of the questions. And I really appreciate you taking the time out. Also, thank you to our audience for taking time out, and hopefully the session was helpful to calm some nerve. As they say, trust the doctor, trust the doctor, trust the doctor. That is the bottom line. They know best. Don't trust the neighbor or your WhatsApp. Don't panic. Most people do recover. I know we've all had losses of life, and unfortunately, hope it doesn't happen anymore. The curve is turning, but does not mean that we don't mask. So same, keep masking. And again, any last word from Dr. Reddy and Dr. Thukral, and then we'll wrap up. Dr. Reddy?
So my last words, be safe and sorry, always stay masked up. No point of double masking or triple masking. One single mask, if you wear it properly, more than sufficient. Vaccination, kindly get it vaccinated, as Dr. Gaurav told. Kindly get it done when your turn is there. Don't delay it. Follow the rules. Trust and consult one doctor and follow one doctor's advice. Don't do multiple consultations so that you get confused. That's my last words.
Thank you, Dr. Reddy and Dr. Gaurav Thukral.
I'll just say, keep your sanities intact. This is very gloomy. This is very depressing. But as the night doesn't last, this too shall pass. And let's not be callous again to invite another wave. Let's all get vaccinated, that next time when the virus strikes, we all have our immune systems intact. So just maintain your mental health, your sanity. Also stay safe. Yeah.
Thank you so much, and thank you to the panel.
One last word from my side. Since Scripbox is a financial company, it manages finances. So there would be some people who want to start raising funds for COVID. So focus on being proactive than reactive. When I say reactive, don't focus on the short term or ultra short term goals. Focus on the long term. Focus on what is the actual bottleneck. Actual bottleneck are healthcare workers. It's like saying, you can buy hundreds of fighter planes, but you can't have hundreds of trained skilled pilots. Same thing goes to healthcare. You can have hundreds of COVID care centers, hundreds of hospitals, but if you don't have people to man it, it's just a building. That's all from my side.
Well, thank you very much, Doctor. We are starting a giving campaign on Scriptbox. So to people who want to contribute, absolutely, and the money will go towards long-term. So this, though this too shall pass, I think let's build the muscle for the long-term and invest in the right places. So thank you, Doctor, for everything you do for the country. Thank you, Dr. Thukral, for all the patients you all have taken care of. We are eternally grateful. And God bless and be safe. Thank you, everybody.
Thank you.
Thank you, sir.
Thank you.
Thank you, Ankit.
Yes, sir. We are done.
You're no longer live, right?
Yeah.
Good. I think it went all right. I don't know how many people participated. I think it was all right. Thanks a lot for organizing this.
Thanks, sir.
Cheers. I'll catch you later. Bye-bye.
Yeah.